Hey everyone, so today we are going to talk about some very, very commonly used drugs, both in the community and in the hospital setting, and those are drugs for smoking cessation. So let's get started. So let's first define nicotine and smoking. What exactly is it? Why is it so addictive? Well, nicotine is the addictive or habit-forming substance in tobacco products. So it's a chemical which creates a release of epinephrine in the brain, and that creates cravings and thereupon creates dependence. So nicotine is the addictive portion of cigarettes. Now, chronic smoking increases the risk of developing multiple chronic and acute health conditions as well. And those include everything ranging from cardiovascular and heart disease, cancers, chronic obstructive pulmonary disease, otherwise known as COPD, greater risk of heart attack, greater risk of stroke, and even reproductive issues in women. They might have difficulty conceiving a child. And of course, smoking is just one additive risk factor on top of any other risk factors the person might already have. So say they have high blood pressure, they might have a family history of heart attack or stroke, and then they decide to start smoking. That greatly increases the risk of having all of these complications. So that's why we want to get people to quit. What's the best way to do that? A lot of people go for nicotine replacement therapy, which is otherwise abbreviated as NRT. Now, one strategy to quit smoking is to essentially replace the nicotine the patient receives from cigarettes with other nicotine-containing drugs. So the thing is, with cigarettes, you just get a pack and you smoke them, all of them, right? But they're all the same dose, kind of. With NRT, the thought behind it is over a few weeks, the dosage of nicotine can be titrated down or gradually reduced until the patient is weaned off of their preferred nicotine product. So they could be weaned off of cigarettes, weaned off of whatever, as long as they're getting that nicotine and it can be slowly decreased. That's essential. That's an essential part in curing that addiction or that dependence on nicotine. Now, dosing is determined by the number of cigarettes or packs smoked per day, as well as a couple other factors. I chose to showcase over here what's your dosage to determine what the starting dosage would be of the nicotine patch or Nicoderm CQ, which is super popular. Nicotine patch, it's placed on the skin to provide a continuous dose of nicotine that reduces cravings. And there's 3 different doses of it. So it comes in 21 milligrams, 14 milligrams, or 7 milligrams. So if you smoke more than 10 cigarettes a day, you start with step 1. If you smoke 10 cigarettes or less per day, you start with step 2. So if you are a heavy smoker, I guess you could define it as, you would start at step 1, starting with the 21 milligram patch. But if you only smoke 5 cigarettes per day, I say only, but if you only smoke 5 cigarettes per day, then you would start at the step 2 patch, because you'd start at 14 milligrams because you don't need as high of a dose of nicotine to get that same effect. And then step 3 is used after completing step 2. Now, if a person starts at step 1, they eventually progress to step 2. They go down from 21 milligrams to 14 milligrams, then to 7 milligrams. And there are other dosage forms for NRT as well. Gum is quite popular, as well as lozenge. People a lot of times want to feel the feeling of something in their mouth if they're missing a cigarette. So many times the inhaler is quite popular, even if it's a bit more expensive than some of the other options. There's even a nicotine nasal spray. So there's a great amount of options that people can use if they want to use nicotine replacement therapy. And I should point out that NRT does not work alone. A lot of people also need support groups. They need the support of their family, their friends to help hold them to it and to stop quitting smoking as well. So NRT is just one part of the therapeutic process of setting your quit date and then doing it. However, if nicotine replacement therapy does not work, we do have some other options, one of them being varenicline or Chantix. Now, Chantix is a drug. It's a tablet that's used to decrease nicotine cravings by affecting the nicotinic receptors in the brain. So the nicotinic receptors react to nicotine in the brain, and they can cause that addiction or dependence feeling of needing that cigarette and that nicotine to get the desired effect. So what varenicline essentially does is it competes with any nicotine that the person is actively ingesting from the cigarettes. And if it gets to those receptors before the nicotine, then the nicotine's not going to have an effect. The smoking becomes less desirable, and they eventually get weaned off of it. So it's sold in 2 4-week packs. So this is the step 1 and step 2 of Chantix. Your first 4 weeks is the green one. The next 4 weeks is the blue one. And patients follow the directions on the boxes so they know when to take the doses. However, because the drug works in the brain, there are many potential psychiatric side effects. This is a brain-affecting drug. It's crossing that blood-brain barrier, that barrier between the bloodstream and the very, very delicate processes which occur within the brain. Therefore, it can sometimes cause problems with cognition or insomnia, abnormal dreams, sleepwalking, and also an increased risk for seizures. So if a patient has a seizure disorder, we generally like to avoid varenicline or Chantix with them. Likewise, bupropion is another option, bupropion or Wellbutrin or Zyban. It's an antidepressant drug, actually. It's used to decrease nicotine cravings for smoking cessation as well. It's also used for the management of depression as well as seasonal affective disorder, which is just a sort of seasonal depression that comes with usually darker times during winter. The problem with bupropion, as good of a drug as it is for helping someone to quit smoking, is it has a lot of drug interactions, especially with other psychiatric and anti-anxiety drugs. So I would be extremely cautious in prescribing bupropion or Wellbutrin to anyone who is taking already a drug for a psychiatric disorder or problem or an anxiety issue like a benzodiazepine. Also, do not use in patients with seizure disorders. It's extremely dangerous to use bupropion in people with seizure disorders. Why? Because it increases the likelihood that they'll have a seizure by lowering the seizure threshold. So the seizure threshold is what triggers a seizure, a level of brain activity that if they go over it, it can cause a seizure in that person. If you lower that threshold, you're lowering what it takes for the body to go into a seizure, and you're putting them at increased risk, which is quite dangerous. Now, suicidal ideation is also common in younger patients, but that's mainly upon the initiation of therapy. Usually after they've been taking it for a few weeks or months, that goes away. It's also quite a common side effect with antidepressants. And I should point out, it's only ideation. That means they're thinking of committing suicide. It's not actual acting upon any of their thoughts. So many times with patients who take similar drugs to bupropion, and indeed patients who take Wellbutrin, you want to counsel them and say, well, it's going to feel worse before it gets better, but you will feel better. Just hang in there, talk to people, talk about your feelings. Other side effects of bupropion are dry mouth, agitation, headache, and then your classics, nausea, vomiting, and dizziness. But that just about sums up all of our options, or our most common options for quitting smoking. As always, if you have any questions, feel free to ask. Thank you very much.